So we did a gluten-free diet, and our two learning goals are what is a gluten-free diet, and the concerns, is there a medical reason versus if you're just trying to be gluten-free.
All right, so a gluten-free diet is defined as a diet that excludes the protein gluten. Gluten-containing products include wheat, barley, rye, and triticale, which is a cross between wheat and rye. And then gluten-free friendly foods that are okay for gluten-free people to eat would be amaranth, arrowroot, gluten-free flours, quinoa, rice, flax, and buckwheat.
Gluten-free diets are essential in managing signs and symptoms in medical conditions, such as these four. Celiac disease is a condition where gluten triggers immune system activity that damages the lining of the small intestine, and in long run prevents absorption of nutrients from food, and it's an autoimmune disorder. Non-celiac gluten sensitivity, signs and symptoms are associated with celiac disease, but there's no damage to small intestine tissues, and the immune system plays a role, but it's not yet known what that role is. Symptoms of this are bloating, abdominal pain, headaches, anxiety, skin rashes, and it is also rare during childhood, but it is more frequent in adulthood with a peak in the fourth decade of life. Gluten ataxia is an autoimmune disorder that affects nerve tissues that control problems with muscle control and voluntary muscle movement. And wheat allergy, like other food allergies, is a result of the immune system mistaking gluten for some other protein found in wheat as a disease-causing agent, such as a virus or bacteria. The immune system creates an antibody to the protein, promoting an immune system response that may result in congestion, breathing difficulties, and other symptoms.
It is important to evaluate the real versus the perceived health benefits of a gluten-free diet if you do not have a medical reason to eat gluten-free. Being on a gluten-free diet is said to be healthier due to the fact that it is beneficial to celiac patients, but the benefits in people who do not have medical issues seem to be unclear. However, other healthy diets like the Mediterranean diet and vegetarian diets offer more information and increased benefits to metabolic and cardiovascular health. Studies show that 3.2 million Americans eat gluten-free even though they do not have celiac disease. But overall, those people had a lower body mass index with a greater amount of weight loss over 1 year, which needs to be interpreted cautiously. A lot of this population was classified as underweight. These patients had a higher average serum HDL cholesterol level, which is active in preventing coronary artery disease, which is a benefit. However, there was no change in hypertension, triglycerides, or fasting glucose levels, and there does not seem to be a lot of benefits because of this. Gluten-free people who do not have a disease are also becoming deficient in several vitamins and minerals because gluten-free foods do not contain enough magnesium, zinc, selenium, folate, calcium, B vitamins, iron, and fiber. This is also reducing the gut microbiome by increasing levels of pathogenic bacteria. Overall, these people feel a sense of health when they lose weight by going gluten-free and tend to eliminate processed carbs, which is also a benefit as they increase consumption of fruits and vegetables. If you are considering going gluten-free for a non-serious health reason, get a medical evaluation and dietary review to determine if you are in a healthy state to eat gluten-free, and research metabolic, cardiovascular risks associated with the diet.
There's an increase in self-prescription of gluten-free diets because 60% of people are experiencing these symptoms of irritability between 15 minutes and 3 hours after consumption of each food.
In conclusion, there are both positives and negatives to having a gluten-free diet, but it is up to you to decide what works best for your lifestyle.